Good evening and thanks for joining us for this update from your coronavirus headquarters. I'm Mike Thompson. Health experts are trying to slow the spread of COVID-19 to keep us safe. Aside from all of the orders in place to keep us home, local health leaders are working around the clock to flatten the curve. News 8 Now's Jordan Fremstad tells us how contact tracing helps control the spread of the disease.
Health leaders don't tell us to stay home and limit essential trips to hear themselves talk.
It's not just to have control, it's to say, we think this is going to make a difference, and I think it is making a difference.
La Crosse County health experts are doing more than just telling us to practice social distancing.
We are doing a lot of work behind the scenes.
Every case has a story.
For the 26 cases that we have so far, we've talked about how our nurses do disease investigation.
There is a process taken to slow down the spread of COVID-19. A person gets tested for COVID-19, and then if it comes back positive, health leaders work to figure out who that person contacted within the 2-week infectious period. Each of those people are notified by local health experts, so those people self-quarantine. Contact tracing informs as many people as possible to stay home so it doesn't spread exponentially.
We have actually spoken with and connected with 157 at a minimum contacts of those that have been confirmed positive with COVID-19.
La Crosse County Health Department Director Jen Rumbalski said in Monday's briefing her staff tries to answer every specific question. The goal is to miss no one. Wisconsin has actually seen a dip in new cases daily since April 6th, according to Wisconsin DHS.
Last week, we're in the 180s or so that it was climbing each day. Over the weekend, we're in the 120s, and now today at 87. This is a good sign.
About 8.5% of people tested in Wisconsin test positive for COVID-19. Rumbalski says about 2.3% of La Crosse County's tests are positive. Things are getting better, but Rumbalski says it's because of the measures in place.
Now is not the time to question if that is working or not. Now is the time to say, great job, everyone. You are doing a really good job, and you're keeping this curve low. And because of that, our hospitals are not overwhelmed.
Reporting in La Crosse, this is Jordan Fremstad, News 8 Now.
Health leaders say it will be a while before things return to normal. They say reopening businesses too soon could cause more harm, which is why officials are cautious to reopen the economy. Well, an update now for you on the numbers of COVID-19 in the state and locally. 3,500 people have now tested positive in Wisconsin for the virus. 170 people have died in the state, and 30% of the people who have tested positive have been hospitalized. There are signs that the Safer at Home is working in the state. Wisconsin was projected to have 22,000 infections by April 8th, which would have resulted in between 440 and 1,500 deaths. That was according to a model created by the state's Department of Health Services. Meanwhile, 2 new cases are being reported in Monroe County, bringing that county's total to 10. No new cases or deaths being reported in La Crosse County. There are now nearly 1,700 positive cases in Minnesota, and there have been at least 79 deaths. Winona County has 30 infected and 6 deaths. Houston County is still reporting only 1 positive case. And in Iowa, Allamakee County has 24 infections and 1 death. The entire state now has nearly 1,900 people who have been tested positive and 49 people who have died. A COVID-19 relief bill is set to go to Wisconsin's Senate after the Assembly approved the bill today. About half of the 99 members of the state Assembly participated remotely in a virtual session to vote on the bill. Today's session was the first time lawmakers have gathered since the pandemic. The Senate will hold a similar session tomorrow to send the bill on to Governor Tony Evers. And Republican Assembly leaders are predicting bipartisan support there for the bill as well. In a statement, State Representative Steve Doyle said, quote, "While I was pleased to vote in favor of this bill today, it's been a little over a month since Governor Evers declared a state of emergency, and it's a shame Wisconsinites had to wait this long for lawmakers to act," end quote. Behavioral health patients in our area are experiencing some changes to their care during this Safer at Home order. Staff at Mayo Clinic Health System in La Crosse are working at home since not long after the orders went in place. Since then, patients are contacted by phone and by using virtual visits. Patients use a special secure program to allow them to connect. The support can be helpful during a stressful time.
This is kind of a recipe for a tough time for people who might be predisposed to developing depression. So we wanted to make sure that we weren't just shutting down those services for people who may really need it at this time.
Mayo Clinic Health System says they have seen almost no drop in the number of patients. Staying as safe as possible from COVID-19 may change how you look at eye care. Contact lenses could put you at risk of contracting the virus if you don't take some extra steps when using them. Be sure to wash your hands when you put your lenses in and take them out, as the virus can be contracted through the eyes. And if your contacts irritate you during the day, that could also put you at a higher risk.
If contact lenses cause irritation or dry eyes, so you want to touch your eyes frequently, probably glasses are a better option.
Glasses can also act as a barrier between germs and your eyes. Well, thank you for joining us for this coronavirus update. You can always get the latest anytime on our website, news8000.com, or download our mobile app. And we hope you can join us tonight at 10.